Limpopo Health Department says preliminary reports by the Cuban government indicate that a medical student who was studying in the country has committed suicide. 26-year-old Evident Pappy Nkoma from Mafefe in the Sekhukhune district was a level 5 medical student. For more on the story, we're now joined on the line by Limpopo Health MEC, Dr. Phophi Ramathuba. A very good morning to you, Dr. Ramathuba. Sad news indeed. What happened?
A morning, Desiree, and morning to all your viewers out there. It's indeed a sad day. Correction, it's Mafefe, it's in Capricorn district. What we were informed, we just received a communication on the 2nd of September that unfortunately one of our students who was there had the suspicion now is that he might have committed suicide, which we are still waiting for the full forensic report as to what could have happened. But from the history, when one look into his profile, he was, of course, diagnosed of a condition last year and was even sent back home. We brought him to the family and he was treated. Everybody thought everything is fine. He went back early in February. We were hoping for him to complete his studies one day and come and improve the lives not just of his family. Because remember, it is the kind of students that we take to Cuba through our late President Nelson Mandela and Fidel Castro scholarship. It's those students that come from those families that indeed there's a real need. You have talented students who ordinarily, when they are in the country, would not make it to can have access to study medicine. But given this opportunity, we were looking forward to have him changing, just to give maybe a family background. He's only survived by his 15-year-old younger sister and an elderly, frail grandmother. So you can see that for us, it's a real loss. We thought we are really investing on a young person who will come and change the villages of Mafefe.
When you speak of a certain history here, do you think that you gave him sufficient support?
We think from the report that we are getting, we think since his arrival, he has been provided the support, and for us to allow him to go back, it's because we thought the problem has been resolved, the condition has been resolved. But of course, we might have missed something which we thought we have not. But at the same time, from February until now, when he was back in Cuba, we do not know exactly what could have happened. That is why part of our investigation is to get from his colleague if there was any sign, because we always, as a department, emphasize, as you have rightfully so, that today is a day where we are making awareness across the globe in terms of the suicide due to depression or any mental condition. So we are always saying it begins with each and every one of us to say your relative, your spouse, your child, your mother, your colleague at work, when you begin to start to see the change, behavioral changes, what are you doing to assist that person? Because unless cases are reported, people might not know. When I begin to withdraw, you know that I'm a bubbly person. I'm always jolly. I'm always laughing. I'm always smiling. But now you see that I'm withdrawn. If I'm a child, I'm no longer playing with other kids. I'm no longer having a social life. What do you do as a person next to? We have lost that caring. People always say it's none of my business. So until such time we go back to those values that we say everyone that is next to me becomes my business. So when things go wrong, we will be able to pick up early and we'll be able to assist and make interventions.
You say it's World Suicide Prevention Day. What can we learn from this particular case in terms of a person, as you say, who is seemingly happy, a student working hard towards achieving their dreams, and then this happens?
I think, yes, we need to use this as a province and the department. We are going to use this particular tragedy to make sure we prevent from happening to any of our citizens, whether they are abroad or they are in the country. We also need to say, when the students come back from Cuba during their recession, we should be able to go and profile each one of them. We must also further on, I was saying to our HOD, look into even the profiling. Our patients who have been diagnosed with cases, conditions that are life-threatening, and like, for instance, you are diagnosed with cancer and you get scared. Not all of us will manage it in the manner which we will be able to accept that condition. Those who are patients who are diagnosed, who are on renal dialysis 3 times a week, that's stressful on its own. Not all the patients will be able to cope. So we need to look into that and see that while we are treating the condition, we must also realize that this is a human being. People take or accept challenges differently. We are also living in difficult situation as a nation. How many people are losing their jobs on a day-to-day? As long as our economy is not performing to our expectation as a nation, people are losing jobs. And when I'm a breadwinner and I'm a man, I've got a family looking at me, some of these people are not able to cope with those financial depression. But the question is, what is it that we can do, those of us who are closer to those persons? I'm just saying the Department of Health or government will not be everywhere, but we are everywhere. There is nobody who is there on their own. We, those who are closer to the person, let's pick up these signs very early of depression, and let's make sure we report to any mental health care practitioner, any facility. Whether it's just to go to a clinic, you will find a professional nurse who is trained in psychiatry. Whether you go to the hospital, you would find a psychologist. You will find social workers who can assist in giving advices. You will find medical doctors who are trained. Not only because I know as government and as a province, we have got a serious challenge of psychiatrists. They are very scarce, but they do have work with certain teams where in not every mental illness must be attended to by the psychiatrist. When you go to that level, you should be referred by a medical officer. So I'm just saying we've got more than enough people who are trained to understand mental health care. So as a nation, let's take this very serious in order for us to reduce the losing, because through depression and which lead into suicide, we are losing a lot of valuable lives. The people that will lose through a suicide, most of the time, when you hear so and so commit suicide, you will therefore be saying, hey, we have really lost. Not that not every life is not valuable.
Ramathuba, we have to finish up. Just a quick one. What is the conversation about the repatriation of Nkoma's remains?
We are in touch with DICO and also with the National Department of Health. We are waiting for the Cuban government to finalize their processes. We have been in conversation this morning. They've indicated that there is just few paperwork to be done with regard to clear the issue of Port Health. Once that is cleared, we will then be able to repatriate his remains, so that it's only after that we can inform you that when will be the funeral, but the burial will be held at his home village.
How's the family holding up?
It is a very difficult a period for everyone. It is very tough, I can tell you. As I've indicated, that when you look at the family, we thought he was going to bring hope. When we selected him, we knew what we were doing as government. We were saying the dream of President Nelson Mandela must continue. You must have a poor black child being able to come back. You must make sure that the origin where I originated does not define my future. We wanted to make sure that happened through him. So it is devastating, not just to his own family, but the villagers around, the chief himself, Bothobejane is also devastated as we communicate with him. Actually, the Limpopo government as a whole is really saddened by this passing and the tragic way that it has happened.
Thank you so much for talking to us this morning, and please send our condolences to the family.